London British Prime Minister Boris Johnson is due this week to present a possible way out of the coronavirus lockdown to get the world's fifth-largest economy back to work without triggering a second spike in cases. The government is obliged to review the lockdown by May 7 and Johnson has said he would like to set out a roadmap and a menu of options for easing restrictions. However, Johnson has also outlined 5 tests that must be met before the restrictions can be lifted in the country with the second highest death toll in Europe after Italy. The National Health Service (NHS) has sufficient capacity to provide critical care and specialist treatment right across the United Kingdom. Government scientists say the number of infections is coming down. Hospital admissions are declining too, as is the number of patients in critical care. In London, there is clear decline in the number of people with COVID-19 in hospital, but the decline is less marked in other regions such as Scotland, the north east of England and the east of England. A sustained and consistent fall in daily deaths from coronavirus. The worst days for deaths were April 21 when 1,172 deaths were reported and April 10 with 1,152. Since April 21, the daily toll went as low as 338 on April 27 and as high as 1,005 on April 24. Deaths rose by 315 to 28,446 on May 2. Government scientists say that while the daily death tolls show a downward trend, they expect them to plateau for a while. Reliable data to show that the rate of infection is decreasing to manageable levels across the board. Johnson has said keeping the reproduction number, R0 or R0 down is absolutely vital. That's the average number of people that one person with the coronavirus infects. Scientists say the R number is in a range of 0.6 to 0.9, whereas it was 3.0 in March. That means each infected person is now, on average, infecting less than one other person. Operational challenges including testing and personal protective equipment (PPE) are in hand with supply able to meet future demand. Health Secretary Matt Hancock said on Friday that the United Kingdom had hit its target of carrying out 100,000 COVID-19 tests a day. He said 122,347 tests were conducted in the 24 hours to 0800 GMT on Friday. However, figures on Sunday showed only 76,496 tests had been carried out the previous day. There have been problems, however, in getting PPE to some front-line health workers and care homes. Confident that any adjustments to the current measures will not risk a second peak of infections that overwhelms the NHS. This is the hardest test to fathom and the most dangerous for Johnson. Scientists will be watching the R number very closely to ensure it does not rise above 1.0. There is no specific treatment for the new coronavirus, nor is there a vaccine as yet. Kuwait Reuters Kuwaiti security forces broke up a riot by Egyptian workers seeking repatriation who were being held in shelters dedicated for those in violation of the Gulf Arab states' residency laws, the Ministry of Interior said on Monday. Security forces intervened after riots and chaos broke out and seized several people who would face legal measures, the statement carried on state media said. Representatives of the Egyptian embassy in Kuwait went to the shelter and reassured workers that repatriation flights would begin this week, the statement said. The Egyptian embassy also apologized for the riots, it added. Several Gulf governments are trying to arrange flights for foreigners stranded or affected by job losses due to the coronavirus pandemic, as well as those whose residencies have expired and will not be renewed. Kuwait agreed last month to allow expatriates violating its residency laws to leave the country without paying fines or air tickets, with women and children due to leave first. Local newspaper Al-Qabas said some 28,000 foreigners out of estimated 160,000 without valid residencies have registered for repatriation and were being held in 34 shelters across the country. It said this included some 6,500 Egyptians, 6,300 Indians and 6,000 Bangladeshis. Millions of expatriates, many from Asia, make up the bulk of the Gulf Arab region's labor force. Initially, coronavirus cases in the region were linked to travel, but Gulf Arab states have seen an increase in infections among low-income migrant workers living in overcrowded accommodation. Kuwait has among the lowest infection counts in the region at some 4,980 cases with 38 deaths. The total for the 6 Gulf Arab states has surpassed 67,600 with 380 deaths.